Hi, Revi here, coming to you from Auburn, Maine. If I can get this PowerPoint slideshow to work. It doesn't want to work. I don't know if it's going to. Hey, buddy. Hi, Revi here, coming to you from Auburn, Maine. I am a family medicine physician pursuing a master's degree in public health through University of New England online. My key interest in pursuing public health is the upstream approach. Too often, as a medical doctor, I see patients once they've already been failed by a society and public health infrastructure. I'd also like to use this opportunity to learn how to format things in a way that is concise and clear and readily accessible, as well as to create long-lasting relationships with local and national public health organizations. In our reading for this week, we talked about the three core principles of public health: assessment, policy development, and assurance. I'd like to take a look at tobacco use as an example of these three things. I think it's important for us to understand the history of how tobacco use came to happen, related to morbidity and mortality, and what we can do as far as prevention. If you take a brief look at the history of tobacco use in the United States, it was used by indigenous peoples before European colonization. It went from being used religiously to a recreational drug. And it wasn't until 1964 that the government published definitive links to tobacco with an increase in incidence of lung cancer. In 1994, a whistleblower leaked thousands of documents showing that the tobacco industry had long since known of the addicting as well as harmful consequences of tobacco usage. In 1998, the Master Settlement Agreement established corporate responsibility for tobacco-related illnesses and the costs in a payment settlement that goes out annually to states that continues to this day. Then in 2006, the United States v. Philip Morris was a legislative case that convicted tobacco industry of violating RICO statutes for fraud. They covered up the addicting and harmful nature of tobacco, as well as for advertising their product to children. If we look at the morbidity and mortality, we see that smoking is the leading cause, which is spelled wrong, of preventable death in the United States. The CDC estimates the smoking-related illness in the United States costs upwards of $300 billion per year. A little more than half of that is for direct medical care. So if a person were to suffer a stroke or a heart attack, that would be the cost of treatment for those things in the hospital and beyond. But we also have to take into consideration lost productivity. So that's employees that are losing their wages because they're unable to work due to illness. Well, the next thing we need to discuss is the types of prevention. When it comes to tobacco use, we can do a few things. We can discourage use through general education, the use of plain packages, which makes them less appealing, especially to children and teenagers, as well as increased taxation on tobacco products. The next would be limited access, so age restrictions such as requiring ID to be shown, geographic restrictions of not being able to sell tobacco products within so many meters of a school, as well as restricting internet advertising and purchasing as a growing number of children and teens are purchasing their tobacco products online. Secondary prevention is treating existing disease burden. Treating existing disease. So you can treat existing tobacco use with nicotine replacement. You can also treat existing tobacco-related conditions, things like worsening of asthma, COPD, high blood pressure, a heart attack, or stroke. Tertiary prevention is reducing the economic burden or the burden of illness for an existing illness. So this would be things like cardiac and stroke rehabilitation programs and occupational therapy for people who are suffering side effects of stroke or just neuropathy due to tobacco use. While researching this, I came across several useful organizations. One is the World Health Organization, we're all familiar with. Second would be the CDC, Centers for Disease Control and Prevention here in the United States. And locally we have the DHHS, the Maine Public Health Association, as well as Healthy Androscoggin, which all have their own primary, secondary, and tertiary goals for tobacco use reduction. Here's a quote I really enjoyed from Whose Report Towards Health and Justice. so that the world is accustomed to thinking of the law as an instrument of justice, but not as an instrument of health. It is time that the tools of law be harnessed in the service of global health and global justice. Thank you.